Hello, hi. Well, thanks very much, Catherine, for inviting me to talk at this wonderful conference. And I'm hopeful to give a perspective today from a clinician perspective, but also as a parent. I work in Colchester as a consultant pediatrician with an interest in neurodisability, but also I'm a parent to my son Freddie, who's 6 years old, and the journey that we've all been on with autistic spectrum disorder and trying to help him communicate and understand the world. And I hope to get across to that today. Moving on. So this is me and Freddie on the beach, and we're looking out to sea and looking out into the blue sky, and we're all feeling and seeing different things. So I'm looking at the sky, I'm having a nice cuddle, and Freddie's reading the water. He's trying to put sand in his mouth, and he's trying to run in the sea. And it is a shared experience that we're both enjoying, but we're enjoying it for different reasons. And I think within the context of communication, that is what it's all about. It's having that shared enjoyment and shared attention to be able to open up and communicate with each other. Moving on. So this is Freddie. He's 6 years old, and as I said, he has a diagnosis of autistic spectrum disorder. But that diagnosis means so much to so many different people, and he has a very complex developmental progress. He really struggles with understanding language. He's pre-verbal, but he also the way he senses the world, and he has lots of sensory processing issues, which at times can make the world very scary for him. And I think in terms of our experiences with him, the frustrations, but also the achievements we've had along the way. I must mention that we first came across PACT back in 2017 when Freddie was at a wonderful preschool called Puzzle in Buckinghamshire, where I first came across the intervention. And it's really helped us along our journey. Moving on. So I tried to give an idea from a parent perspective, the barriers to communication. And I think having the diagnosis of autism when Freddie had at the age of 2 is a devastating one to families. He was our first child, and the automatic response we had was one of grief. We felt that we'd lost our son. Up until that point, we thought his development had been neurotypical, and gradually the way he interacted, the way he looked to communicate, and everything seemed to move. He seemed to become a different child. And for any parent, that is a tremendous burden to accept. You then follows on a tremendous thing of trying everything mentality, where you are desperately trying to help your own child and trying to understand them and try to help with their development. Other barriers are time. So inherently, you're very stressed, and again, that can be a barrier to communication. Desperation, the tiredness you get with looking after a child with a neurodisability, and the feeling of isolation, fear and stress, and all of these are tremendous barriers because I've certainly found with my own son and other children, they can pick up on stress tremendously. And wanting a child to engage in that shared attention and shared interaction that's so important to initiate communication starts to move away. Moving on. So in terms of intervention essentials, anything I would say from a parent perspective needs to be practical. It needs to be fun. It needs to be easy to carry out. And it needs to be aimed at promoting a bond. I think the bond is the key thing. Because when you realize your child is on a different developmental trajectory, you automatically start to think of them differently. You start to premeditate what their wants and needs, and all those opportunities to communicate that they have go away. And I think really importantly is for it to be able to be supported by a professional. And in the times we're in at the moment, that support is very variable across different areas of the NHS. And I think certainly looking back in hindsight, I think that's something we really didn't get. And I think initially, and I think that's something that's key for parents and their children. Moving on. So in terms of a lived experience of an intervention, I've certainly found that less is more, and to really take off the pressure off. As a parent, I found being a parent very difficult, and you live through your children and you want them to be the best that they can be. And when a child really struggles in certain areas such as speech, The pressure is on to get them to talk and understand language. And I really don't think it's about that. It's about the enjoyment and the opportunity to communicate and to enjoy the quality time together. Because if you don't have that quality time, you start losing that bond, that your child kind of starts to move away from you. And that, as a parent, is an awful feeling. And I think that's the main take home from Pact is it enables that bond to continue, and to really reflect on the enjoyment of just being together. The pressure is off. It's very simple intervention, and you can just enjoy being together. And I suppose the other thing to think is, what is a good outcome? Within the NHS, we always try and outcome things, and I really don't think at the moment that we do look at the right outcomes. A lot of them are financial, and a lot of them are patient number, seeing large volumes of children getting diagnosis and moving on, whereas we should be being more forward thinking, getting children seen earlier, but also as an intervention. Early intervention is, I would say, is very key, and seeing children who are picked up early via Pact is via health visitors and other professionals is very important. And the last thing, it's not a competition. And I've also found along our journey with other parents is that it can become like, my child said this, or we've done that. And again, it's not about that. And to try and take the pressure off yourself as a parent, to say, this is where we are. I'm enjoying this time we're having together. If we get this outcome, then all well and good. But at this moment, in this point of time, I'm happy with how things are going. And moving on. The caveats to, I would say, more behavioural interventions are that a lot of the children I see, including my son, have quite significant health comorbidities, gastrointestinal problems and pain. And a child who is unwell, and a child doesn't feel very well, isn't going to want to communicate. Also, siblings can want to hog the limelight. So his sister can want to be the centre of attention, which can put Freddie off. And the sensory processing issues can really impact. So the environment you're in, you really need to pick the right setting and have the right motivations. Moving on. And from the clinician experience, I'm a consultant lead in neurodisability at ESNEFT, and I'm a research lead. I'm really, one of my main focuses is trying to translate research into practice, and the utility of interventions to really improve outcomes. And we managed to get some money for an 8-family pilot project within ESNEFT. So many thanks for the charity who provided the money for that. And I must say thank you to the support from Alex Wilmore and Hayley Foster, our speech and language therapists. And the project was started at the back end of last year, and unfortunately, COVID has made that there's been some up and downs with that. But I think the overwhelming response has been great. So I really hope to further our work with that. Moving on. So the future goals of myself and the work I do is early intervention in neurodevelopment in general, to try and provide translational research in the work that I do, and always look at questioning outcomes and aims of existing pathways, because as clinicians, we always put down pathways without really having the right, I think, the right outcomes. And I think something like Pact is ideal and should be widely utilized, and that's certainly the aim of my trust, as where we're going from here. And I think it's a tremendous day, and I thank everyone for coming to the conference. And I think from a professional and a personal perspective, Pact has been a tremendous asset for us. And as I said, for all the things that I've tried to structure in terms of the barriers to communication, but also the lived experience of their journey through autism, how useful it's been. And I hope that in terms of the future, that a lot more trusts will see the intervention as an opportunity to really push on and change the way that the early autism pathway is mapped out. And many thanks for inviting me to talk. And I think I'm passing on to Louisa now, who is a fellow parent. But these are my two together. You can see that's Evie on top, who's an expert in intensive interaction, and she's been tremendously helpful again in promoting Freddie's development. And and I hope you enjoy the rest of the conference.